Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Mudupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. Today we are looking at food fortification. According to UNICEF, about 45% of death are attributed to malnutrition in children under 5 years of age. Only 2 out of 10 of these children are helped through micronutrient, through all forms of nutrients. That is called food fortification. This is our focus today. We'll try to look at what exactly is food fortification. Stay tuned. The conversation begins after this break. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Kunle Ishola. He is a Senior Programs Officer and TPAC Project Lead, Civil Society Scaling Up Nutrition in Nigeria. And he is going to share his expertise on what exactly is food fortification. Why is food fortification important in addressing malnutrition in Nigeria? Good evening, Kunle Ishola, and thanks for joining us.
Yeah, good evening so much. Thanks for having me once again on Sound Health. Thank you so much.
All right. Tell us, what exactly is food fortification? UNICEF said it is a good intervention in addressing malnutrition in children. Why is food fortification important?
Okay, all right, let me start with what food fortification is. It's actually an evidence solution intervention whereby micronutrients, specifically minerals and vitamins, are added to food to buffer for the loss or the reduction of micronutrients that is meant originally to be in the food that we eat. And that's food fortification. Even from the word, when you say you fortify something, it means you're adding a particular strength to it. So the reason why we eat food is not just not to satisfy our stomach alone. It is for growth and development of the body. But if the food that we eat is devoid of the nutrients that it's needed to be there, then we are only eating shafts and nothing more. So to buffer for the loss of the nutrients that might happen throughout along the value chain, the production value chain, from farm to the table of the consumers, that is why fortification is needed. The addition of these minerals, the nutrients, so as to improve the nutritional value of the food that we consume. So why do we need it? You agree with me that there's a lot of factors, environmental factors, and alongside a lot of factors that actually affect this. Starting from the seed that is sown in the farm. Some seed are actually devoid of the nutrients because they are not qualitative seeds in themselves. And just as the saying goes, whatever you sow, you will reap. You don't expect to sow a bad seed and expect good products. So from that point, even across when they are grown, throughout the transportation process, whatever storage process, till it gets to the table of the consumers, you want to ensure. So those nutrients that are lost, that's why we need food fortification. Those that are reduced, some do not have the adequate nutrients in them. They are reduced. We have to buffer for the adequacy that is needed, and some do not have at all. So basically that's what food fortification is, and that's why we need it. And of course, you agree with me, in Nigeria of today, and these are factors that we are actually used to: the storages, the transportation process, and every other factors that we can actually think of. Then also, it's also cost effective. You ask me, how do we get these nutrients, these micronutrients, the vitamins, the minerals to the large populace that we have in Nigeria? So we customize vehicles. So it is easier for us to insert these micronutrients in the most commonly consumed foods in country. Your guess is my guess. The first thing that will come to our mind as Nigerians is rice.
Okay.
Everybody eats rice, Even the food vendor that is on the roadside, if you don't have rice, you're not likely to be patronized well in Nigeria. So rice, flour, maize, the bouillons, the condiments, things that you add to food to give it flavor, the salt, exactly. So because it is largely consumed, in fact, that is where the concept of large-scale food fortification comes in.
Okay.
The staple foods that are largely consumed are being fortified so I can get to the populace. adequately.
All right. Thank you for mentioning this food. I was going to ask if there are specific foods or category of foods that are fortified. Okay. Thank you for mentioning, or you listed some. Okay. I want to know now, what are the essential vitamins or nutrients or micronutrients that are needed for food fortification, or that are required by children, not just children now, or anybody that consume foods?
Yeah, thank you for that question. So from the micronutrients, from the division I had earlier, I've divided them into two: the vitamins and the minerals. So let me start with the vitamins. So we have the folic acid. We call it vitamin B9. Mostly, you must have heard that pregnant women are told to take IFA, what we call the iron folic acid. So the folic acid there is vitamin B9, which helps with to prevent neural defects. Something that we call the spinal bifida, that makes the spine and the spinal cord of the fetus in the womb not to properly grow. It creates a kind of gap in the spinal cord of the fetus in the womb, which is so it prevents that. That's for the B9 folic acid. We have the vitamin A, of course, from the elementary science. Vitamin A is for sight, and it also helps in some immune functions too. For sight, we have vitamin D. Vitamin D helps it helps the body to absorb calcium well, and calcium is actually good for bone strengthening and bone health. So it helps the absorption of this bone. Then the B vitamins, we have B1, B2, B6, we have B13, as the case may be. They help us in metabolism and nervous system function, and of course helps with energy levels. That's for the vitamins. Now going to the minerals, as we have iron, very very important. It helps in preventing nutritional anemia. Exactly. If that is why when I was talking about the iron folic acid, which is good for maternal health and also the fetal health, the fetus in the womb, the health of the fetus in the womb itself. We have iodine too. It's one of the minerals. Years ago, we were talking about this widespread of goiter, this fatty thing that comes out on the neck of people, and in some places they will think some people has been bewitched over the years. Not until sciences came to be and came to our rescue to tell us that no, what is bewitched is a deficiency in the micronutrients that is called iodine. And so, because of fortification, this has been infused into salts. So we have iodized salts, and that is why we do not have a bulk of all this the goiter thing that we always see. I'm not sure I've seen anyone lately in years now at the moment. So we have calcium. I mentioned about calcium the other time. It's good for bone health. For bone health, we have zinc, we have selenium. So these are the micronutrients. They are micronutrients because they are needed in small quantity, but that does not mean that what they do is actually small. They are very much significant to the growth and development of everybody, including the fetus in the womb, with the mothers and the general populace. So these are the micronutrients.
Okay, are there alternatives to this food fortification? Because I know not everybody would have access to these fortified foods. Do you think these foods that are fortified would not lose their the nutrients during processing because they are heavily processed?
Okay. Firstly, to start with, for every food that will be fortified, they go through protocols of engagement that is being monitored by our regulatory bodies. Nobody just sits behind the back of their house and say, I want to fortify this, I want to fortify oil, I want to fortify salt or something. No. There is a protocol of engagement that the NAFDAC does. The NAFDAC and the Standard Organization of Nigeria. So they follow the protocol, the amount, the volume, every specification clearly stated, and they will be monitored to ensure that they don't go around it. So every of the preventionary method to ensure that this is not taken throughout the processing process is being monitored by these regulatory bodies. Yes. So nobody just sits down and just want to fortify on their own. No.
Okay.
There is a protocol of engagement that's being monitored by regulatory bodies, NAVDAC and SON specifically.
Okay, how do you bring on board SMEs now? Because I know we also have small-scale manufacturers that are into food processing. How do you bring them on board, and you are not just looking at large-scale food fortification?
Okay, for the SMEs, it's the project I presently lead on, the TPAC project, that is third party advocacy campaign. So one of the things, even though this is for oil, it's still part of the food products we're talking about. One of the things we have actually done is to bring together producers and the consumers now, and also the retailers too. So we have the retailers there, and the idea is this: some of them from my engagement with them, they do not even know they need to fortify what they have. Some of them are not even registered. We have to tell them that go and register. So for the SMEs, it is more of a capacity building exercise for them to know that whatever they're doing at that small scale needs to be fortified. And then they have to work with the regulatory bodies in country to guide them appropriately on how to get it fortified with the standards that is in the books
Okay.
as laid down by the government.
Okay. Are these food produce affordable because they are fortified? Are they affordable compared to non-fortified foods?
Okay, I would like to address this in two ways. In the market space, the fortified foods are actually more expensive than the non-fortified foods. Or better put, the non-fortified foods are not as expensive as the fortified foods. And the reason is obvious from what I've explained earlier. But I would like us to see it this way. Which one is more expensive? Would you want to be malnourished that will land you in the health facility and you pay more? Because most of UNICEF has told us in research surveys that most of the child death that we have, 50% of them, half of them is actually pointing towards malnutrition. 50% of child death. And when you're talking about malnutrition, all of these nutrition you're talking about, it definitely is, that's what we're discussing about. So it is better, I feel that it is cost effective to spend more on nutritious food now than to go and pay later in the health facilities huge amount of money. He said prevention is better and cheaper than cure. So one of the ways whereby you can save yourself from spending more in the hospital is you invest more. It depends on what you call cheap. You invest more in nutritious food.
Okay.
So this popular saying that you make food your medicine so that you don't eventually make medicine your food. Making food your medicine is cheaper. In all honesty, nutritious food in this sense is cheaper than making medicine your food because you spend more on the medications, spend more on health facilities and all of those things. So it depends on what you call cost effectiveness and what you call cheap. I feel that investing in nutritious food, fortified foods with adequate nutrients is cheaper than spending more in the health facilities. Thank you.
What do you have to say to parents, nursing mothers, expectant mothers about food fortification? Those that still, some people still hold some myth and misconceptions about this category of food.
Firstly, it is safe. Let's get that clear. It is safe. And it's helping us. One of the things I would have loved to mention is dietary diversity. How that we consume variants of food, what we call balanced diet in primary 6 and all of that. Now it's probably called adequate diet. But I can tell you that at most Nigerians, how many people do consume every of these sources of nutrients adequately across board? So this has come to stay to tell us that it can buffer for our inadequacies and insufficiencies in the nutrients that we have in our body. So it is safe. That's the first thing. And maybe some might not know. I think this is a platform for them to know. When you get oil in the market, for example, there is an I logo that is on the label of these oils. It shows that it has been fortified with vitamin A. That's very clear. So people from the consumers, they need to demand more for fortified products so that the supply can be complementary from the producers. And I think that's the way to go, both ends.
Apart from that logo, are there other signs to know that you're buying a fortified food?
All right, because as advocates, we've been working with the regulatory bodies, as I mentioned earlier, the NAFDAC, the SON. Definitely, we do not expect any consumer to buy any product in the market that does not have these certifications, because the reason why they are given the certification numbers and all of that is because they have gone through the laboratory process. There is a government certified laboratory whereby these products are tested to meet up with the standard as stated in the books. So we don't, for example, when we're talking about the oil, there are so many oils in the market that are not certified. No NAFDAC, no SO regulation, they are not fortified. And most of these oils are detrimental to the health. In fact, they have accumulative negative effects on the populace, and people continuously consume them. So you want to check all the labeling very well. As NAFDAC, they ensure that you have the right label, the right numbers and all of that. SOM work with the standards, with the standard itself. Are they working with the standard as in the books with respect to the food products that we are talking about? Whether it's cereals, whether it's fat and oil, condiments, as the case may be.
Okay, let's quickly look at some of the challenges experienced in achieving food fortification across board.
Okay, yeah. Firstly, I think it's awareness, public awareness. Public awareness is very very key, which is one of the things that we advocates are doing now. We don't want to assume, it will be a costly assumption to think that the whole of the Nigerian populace are aware that some food are fortified. I've met a lot of people that they have no idea what fortification is. Not to talk of LSFF and all other things. So awareness is very key. So it is a big challenge, and that is why we have to look to our media, our communication experts, just as we're doing at the moment, to sensitize people more about fortification, the food that are fortified, and why they should increase the demand on fortification. So awareness is very very key. Also, one of the challenges we're also having is the continuous monitoring which of our regulatory bodies on these food products. So most times what we have found out is that once the certification is given, sometimes in some places they are not followed up to ensure. One of the challenges that we might have is having to get our regulatory bodies to conduct adequate monitoring of these food products, not for the first instance. So after the first instance whereby the certification has been given and the license to roll out the products in the market, we need consistent engagement to see that the standards are actually adhered to, not at the section alone, but also for subsequent production from these production companies. Yeah.
Your final words as we wrap up now.
All right. Firstly, I want to say that this is an adage that says that if two dirty hands refuse to wash each other, if two dirty hands refuse to wash each other, they will remain dirty. So this capacity building, information dissemination around fortification, food fortification, and the likes is everybody's business, both the consumer, the producer, the government, the civil society organizations, to ensure that one, demands are created for fortified foods, because not every food, there is no single food that you can actually get all these nutrients adequately. So that's why we preach dietary diversification, and also even these fortified food products across this. So it's work for everybody. The government has to start to bear to ensure that these production companies, they adhere strictly to the standards. Else we'll be having so much detrimental effect even on the populace as they consume this. The same thing, then the CSOs can also help us go wide across the 36 states of Nigeria, including the FCT, to let people know that yes, fortified foods are safe. They are safe. They are safe for the body's growth and development.
All right.
And definitely, we cannot rule out the work of the media in helping us with the adequate communication and right information in this case.
All right.
Thank you so much.
You are most welcome. Fortified food are safe and good for body growth. Thank you so much, Kunle Ishola, Senior Program Officer and TPAC Project Lead, Civil Society Scaling Up Nutrition in Nigeria, for your thoughts and expertise on food fortification, essence of food fortification in addressing malnutrition.
Thank you so much for having me.
You are most welcome. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. We have been talking about food fortification, an important or significant intervention in addressing malnutrition in Nigeria and across the. You are what you eat. Fortified foods are safe. They are nutritious to the body. Make sure you get one today if you truly want to beat diseases, preventable diseases as well as malnutrition, stunting, wasting, and underweight children in Nigeria. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 00358266603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.